Thank you very much to Gráinne and to Susan. Really appreciate you coming on today to open our day. So it's my job to say hello and welcome everybody. Thank you very much for coming. You will get sick of my face and I apologize in advance. So my job today is just to set the scene for the morning. It's to give you a bit of a background of the project and to give an overview of what we're going to be covering during this morning. So just to introduce you to Children's Palliative Care Services in Ireland, this is a nationally coordinated service. It comprises of hospital-based specialist paediatric palliative care teams. In the community, we have clinical nurse coordinators for children with life-limiting conditions. We're also supported by the community specialist palliative care teams and, of course, specialist hospice care in Laurelin and others. So one of the challenges that was faced in children's palliative care is that it is very hard to plan and further develop this service when you know very little about the population who might need it. So that is the challenge that we were faced with in the lead up to this project. So in the past, what we did was there was an initial scoping exercise back in 2021 to identify how you might go about finding out more about the population who might need it. For example, a very simple question, how many children might need specialist palliative care? And what are the challenges in hospital? Are there lengthy hospital stays, etc.? We have lots of anecdotal evidence, but what can we actually show in data? So through this scoping exercise back in 2021, then we were funded to do the project application, and we were very fortunate to get the HRB Applied Partnership Award in 2023 with co-funding from Irish Hospice Foundation and Laura Lynn. So just as an aside, one of the valuable things from this long lead into this project was the fact that we had the time and the support to develop a collaboration, a strong collaboration, so that we were able to hit the ground running when we did get the funding. As Gráinne said and Susan said, it's coming at good time. The findings are coming out just when there is a commitment in our programme for government to evaluate and revise the National Children's Palliative Care Policy. So this work can hopefully feed into that. So our team, as I said, is a collaboration. This is a feature of an Applied Partnership Award. And as I have to say, it's a very welcome feature of this because it means that you have knowledge users with PPI representation working alongside researchers. So I'm not going to go through all the names, but they are all there. Many of you are in the audience, and thank you so much for all of your contribution to this project. So these are our knowledge users. We worked alongside researchers. We worked alongside data controllers and, of course, our co-funding partners. So this is running through this slide, but it's kind of a key slide. This is our collaboration. We worked together on this. So in terms of the study, our aim was to use existing Irish national healthcare data to guide and enhance children's palliative care policy, planning and service delivery. And we undertook two broad phases of work. The first was defining our terms. What do we mean by need for children's palliative care? How can it be defined and how can it be quantified? We're not specifically presenting on this phase of work today, but it does form the background for what we're presenting on. So the second phase was then interrogating the data. How can we find out more about the population likely to need children's palliative care in Ireland? And we've undertaken kind of 3 stages. So what we'll be presenting today is based on these 3 stages of work. The first is how many children? Can we estimate how many children in Ireland have a life-limited condition? This is important because you need to quantify need for children's palliative care. The second stage then was looking at hospital use patterns because it's important to understand their resource use. We understand from other small number of countries that they are likely to be resource use intensive, but we have very little evidence for Ireland. And then the third stage is kind of, well, what's next? What else do we need to know? Where are the data limitations and where are we going now? So that forms the basis for our format this morning. And through all of these, we'll be presenting what we did and why, what we found, and what this means for policymakers and providers. Some explanations before we start. Children's palliative care. For those of you who don't know, I'll be surprised if anyone in the room doesn't know, but it involves, using the WHO definition, it involves the active, total care of the child's mind, body, spirit, and support for the family. It ideally begins when the illness is diagnosed, And it continues even if the child is also receiving curative treatment. So it may be needed for a few days, or it may extend over many years of the child's life. What is a child? For this work, the definition of our child is infants, children, and adolescents from the age of 0 to 19. We know that the formal cutoff age for paediatric care is age 16, but we also know that many children with complex serious illness continue to be treated by paediatric services up to the age of 19. So hence we have a rather broad definition of childhood. Why the focus on 2019? Some of you are thinking, we're in 2026, why do we keep referencing 2019 data? We have analysed data from 2009 up to 2024. You all know that there was a pandemic, there was a dramatic impact on hospital activity in 2020. So through our analysis, we have seen that patterns of hospital activity still seem to be kind of recovering or returning to a pre-pandemic position. Until we see 2025 and 2026, we don't really know what the new normal is. So 2019 seems for us a useful benchmark, but just to be reassured, we have looked at the whole time period, and most of our findings are representative of the entire time period.